a few questions about cataract surgery. Who is a candidate for cataract surgery, and what exactly does that entail?
So let's define what cataracts are. Cataracts, you have a lens in the eye. So the predominant job of that lens when we're young is to help you focus up close. Two aging things that occur to the lens is, number one, as you get older, that focusing mechanism decreases. Who cares? It's not until the 40s when you notice it. That's when your arms don't stretch out. That's when you need more light.
What's the cause of that, though? Is
age.
it just like muscles or a fog that accumulates on your eyes, or just...
Well, we can get technical about it. It's simple. It's like asking me what's the cause of gray hair and wrinkles.
Age.
Well, we all get it. Some people sooner than later, but you get it. So then you need reading glasses, and it progresses. Second thing is, when we're young, that lens is clear. Okay, just like our skin is nice and clear. As we get older, that lens gets cloudier, smudgier, like getting a thumbprint on your glasses. Keeps going. That's a cataract. Okay, but who cares? A cataract, visually significant cataract, is one where probably your dad, even with new glasses, he tells you, Doc, I can't drive very well. I don't see that TV, that football player. I can't read the scores. That's when it's bothering your vision. And glasses and contacts won't help. So that's the solution to that, is we got to replace that dirty lens or that non-clear lens and replace it with an artificial implant. That's cataract surgery. That's all it is.
And is that one eye at a time? I mean, that's probably
one eye at a time,
necessary.
Yeah. We can theoretically do 2 eyes at a time. We do 1 eye at a time for safety.
Is it recommended that a patient can drive themselves home after the procedure, or probably not?
Probably not, especially in the United States because of medical legal reasons.
Good
you
point.
have to have a driver.
Post-operative recovery, what is a patient looking at for that? Is it an inconvenience for a number of days, a week? What do you think?
Gosh, it's really easy. So let's go over a little bit of the history. About 30 years ago, in your grandpa's age, cataract surgery, they had sandbags on their eyes. We didn't have sutures. They had to keep them in the hospital for 2 weeks, let the eye seal.
Really?
When I started training not too long ago, I'm aging myself, we used to make a big cut into the eye, take out the whole lens, put stitches in the eye, and then we wait 1 month, 2 months, 3 months, and then finally give them their glasses that they can see with, right? Mm-hmm. Today, we have lasers assist us. Surgery takes about 10 minutes. You go home that day. You pretty much go back to normal activities. Obviously, you have to take some eye drops, antibiotic drops, and our results are pretty good. We have implants now. Most people don't need more glasses, even reading glasses. So technology has really gone far with this surgery.